Good afternoon. Perhaps we'll get started. It is 12:30, and I'm very pleased to be welcoming all of you, our on-site audience, as well as our online audience, to the second OEH seminar series of the academic year 2015-2016. And of great pleasure is to welcome our speaker for this seminar, who is Michael Branion-Calles. Michael is a new PhD student in the Department of Health Sciences at Simon Fraser University and a recent graduate in the Department of Geography at the University of Victoria. Michael is a geographer by trade, and his broader research interests include the development and application of spatial and spatial temporal analyses to address applied questions in health research. Michael is passionate about maps and population health, and as a result, his research interests are really only limited by the criteria that the data being analyzed are mappable and that the results have the potential to affect positive change in population health. I'm sure Michael's passion will come through in his seminar that he's giving us today, modeling and mapping regional indoor radon risk in British Columbia, Canada. Michael.
Thank you for that introduction. I'm not sure my enthusiasm will actually show through. A lot of my TA evaluation said I lacked enthusiasm, so I think it's just the lack of change of tone in the voice. But I am actually passionate about it. So anyways, my name is Michael, and I'm basically just going to be presenting my master's research, which I just finished up in late July. And so my research was conducted in conjunction with the BC Centre for Disease Control, and my co-supervisor was Dr. Sarah Henderson, who I'm sure most of you know. And so, yeah, I'll just sort of get right into it. So just a quick overview of what I'm going to be talking about for the next 45 minutes or so is I'm first going to introduce radon, what it is, why it's a problem, and sort of a broader look at the environmental variables which affect a given individual radon concentration within a residential home. And then talk about the two papers that made up my thesis. So the first one being developing a novel method to map regional radon risk, and doing so by combining different geospatial data sets and creating a model from that. And then figuring out which of the variables are most important to predicting areas of high risk and how they affect the probability of predicting high-risk areas. And then the second part is building upon this novel method by defining risk using different concentration thresholds, which I'll talk about more as we get into it, and then comparing how crude lung cancer mortality trends differ between areas predicted to be high risk and predicted to be low risk. So I'm going to start with what is radon. And so I have a picture of Mike Holmes here. And if you don't know who Mike Holmes is, he's a reality TV star on Home and Garden television network. And his whole show is based around the fact that he is a very honest and good contractor who goes in and fixes disastrous renovations. And I was already a fan of Mike Holmes, and then I saw him in a commercial on TV, which I'm not sure if everyone here has seen. Hopefully you have. But in this commercial, he is essentially just promoting radon awareness and telling people what radon is, and that it's a naturally occurring radioactive gas that can accumulate to high concentrations, and it causes lung cancer. And people should test their homes for it and implement readily available remediation measures to lower the concentration in their home by reliably around 90% most of the time. And so I was also glad that this commercial came on, because now I had a segue into explaining what radon is in my presentations. Because it's invisible, it's hard to visualize in a slide. So anyways, like Mike Holmes explains, radon is a naturally occurring radioactive carcinogenic gas that's produced by the radioactive decay sequence of uranium. So uranium is found in at least trace amounts in all rocks and soils throughout the world. And as a result, there is some concentration of radon in any volume of air in the world. And so radon, due to its gaseous nature and its relatively long half-life can travel from its source towards the Earth's surface, where it is exhaled. And in the open atmosphere, it's diluted to very low concentrations. But within an enclosed space in contact with the surface of the Earth, concentrations can accumulate. And so radon, as I mentioned, is a carcinogen. It's the #1 leading cause of lung cancer in non-smokers and the second leading cause of lung cancer worldwide. And the dose-response relationship is approximately linear, so your risk of developing lung cancer increases linearly with increasing concentrations. And this is fairly important for a lot of radon policy going forward, and ends up affecting a lot of the radon mapping products that are out there that are based on observed concentration data, because effectively you have to delineate areas into areas that are low or high risk, and for individual homes you also have to figure out what concentration is the risk of developing lung cancer is acceptable versus unacceptable. And as a result, there's a wide range of concentration thresholds provided by various organizations and governments throughout the world, each of which is somewhat arbitrary. So this will, I'll talk a little bit more about this. This is sort of the primary focus of the second part of the presentation. Yeah, so now that we know what radon is and how it affects human health, I'm going to talk about some of the factors in very general and broad terms that will affect an individual concentration within a given home. So I like to think of them as sort of three sets of factors that are each interacting with one another. So the first set of factors are those factors which will affect the production of radon within the Earth's surface, which is primarily controlled by the quantity of its parent material. So its immediate parent material is radium, and by extension, the amount of uranium within the Earth's surface will also be a good predictor of how much radon is being produced. And so there's also a variety of characteristics which will affect what's called the emanation coefficient, so what proportion of radon atoms being produced within the grains of the soil are actually making it into the pore space and are available to be transported through diffusive or advective action towards the near surface. And this is going to be affected by grain size, characteristics of the pore space, like tortuosity, the porosity, permeability. And so within the subsurface, diffusive movement is the dominant mode of transport for radon. And this is mostly affected by soil moisture and also soil characteristics such as permeability and porosity. And so that's sort of the first two sets of factors. And so essentially it's going to be contingent upon geologic characteristics and climate characteristics. And the third set of factors are the one that really add a lot of complication towards predicting an individual concentration, which are primarily to do with the advective movement of radon-containing soil gas. So this is going to be controlled by primarily the pressure differential that's created by the difference between indoor and outdoor air. And it's also going to be heavily affected by housing characteristics. So what type of substructure your home has. Is it crawl space, slab on grade? Do you have a basement? Do you have lots of cracks in your foundation? So anything that will increase the amount of entry points and the rate at which radon is transported into your home will obviously increase your concentration. And so there's also ventilation characteristics that will affect the accumulation of indoor radon in your home. So essentially, all we really need to know moving forward is that radon concentrations are highly variable in short spatial distances. Neighboring homes can have concentrations that vary by several orders of magnitude, but regionally, the dominant predictors of the proportion of homes that will have a high concentration are generally geologic in nature. So you would expect an area that has normally a high amount of uranium in most of the soils will have a high proportion of homes that exceed maybe a concentration threshold of 200 becquerels per meter cubed, let's say. And so I should mention becquerels is a measure of radioactivity. Yeah. And so in British Columbia, we have many large and small radon-prone communities. And we know this because we have a data set archived at the BC Centre for Disease Control of approximately or exactly 4,352 indoor radon observations. I spent a lot of time with this data set. And so in British Columbia, we have some radon mapping products that have been done in studies previously. And so radon maps are important in terms of health surveillance as well as being able to gauge which areas are more prone to having higher concentrations than others. And so this particular radon map was created using this data set here. And essentially, this is where concentration thresholds come into play quite a bit. And it was classified into units of low, moderate, or high radon risk based on the proportion of homes that exceeded Health Canada's concentration guidelines. And so, for example, if 5% of homes had concentrations that exceeded 600 becquerels per meter cubed, that local health area was considered high risk. And so you can also see from this map that the spatial units used are quite large. So these are local health areas, and using large spatial units can serve to hide a lot of the variability within the units and can mask some populations at risk within areas that are characterized as low, for example, because there might be smaller areas which have high risk. So if you aggregated it at the community level, maybe that one of those communities out of 10 would have a high risk, which wouldn't show up using large spatial units. So this brings me to the first paper, which was essentially concerned with creating a radon map that delineated the province into classes of low, moderate, and high based on a smaller spatial unit. And in this way, we can come up with more spatially refined maps that can take into account that within unit variability that you would have seen in the local health area map. And so in order to do this, we combined a bunch of different geospatial data sets. So I don't know how familiar everybody is with geographic information systems software, but I guess I will try and explain it as best I can for those of you who don't. So the spatial unit of prediction in the map I showed you before with the local health was a local health area. And so the idea was to use smaller spatial units and predict radon risk from that. Unfortunately, if you use smaller spatial units, then that means that you'll have less continuous coverage or less continuous estimates of risk. And so when we use a smaller spatial unit, we selected what we call the bedrock dissemination area. It's just an intersection between the boundaries of simplified bedrock lithology and census dissemination area boundaries. In this figure here, you can see the ones that have this cross pattern here are the ones in which there are observed concentrations, and the rest of them that are gray do not. And so the idea was then to assign each of those, or every single bedrock dissemination area, a characteristic, a series of predictor variables that would describe why a certain area would be classified as low, moderate, or high, as well as assign the observed concentrate, or the ones that have observed concentrations, a rating of low, moderate, or high based on the observed concentrations. So We define low, moderate, or high based on the concentration thresholds of 200 becquerels per meter cubed and 600 becquerels per meter cubed, which are provided by Health Canada as a way of gauging what is a low or at a safe exposure, I guess, to unsafe exposure. So both moderate and high are unsafe, but high requires a greater expediency in your remediation measures. So we used the 95th percentile concentration occurring within a bedrock dissemination area and compared it to these concentration thresholds and assigned it a class of low if it was below 200 becquerels per meter cubed, and a class of moderate if it was between 200 and 600, and high if it was greater. And so we had a data set of 1,054 bedrock dissemination areas, each of which had an observed indoor radon. We termed it vulnerability classification, and around 27,000 that did not. And so the next step was to assign a series of predictor variables at that bedrock dissemination area level based on overlaying soil data sets, climate data sets, hydrologic data sets, geologic data sets, and aggregate housing data. And so each of these predictor variables were selected based on the premise that they would individually or in combination with each other describe the dominant soil characteristics of that bedrock dissemination area. So the type of parent material of a soil will heavily affect its current form, so how it was deposited, as well as the drainage class and the depth to which roots can grow, and coarse fragment content will all sort of combine to create one sort of unique regional characteristic. One region might be defined by soils that are more prone to saturation, so that would also combine with precipitation data. And also temperature will sort of be a proxy for air exchange rates, especially during the winter. And so we also had hydrologic data. So this one was kind of an interesting predictor variable to include. There was some informal analyses that indicated that homes primarily in the interior of the province built near major rivers had elevated concentrations, and it was thought that essentially because they were built upon fluvial deposits that were enriched in uranium due to erosion of upstream uranium-enriched geology.
Testing.
Hello? Okay. Also, where was I? So we included that predictor variable as sort of a way of testing that hypothesis. Okay. So moving on, the remainder of the predictor variables were all selected essentially because they could serve to enhance or reduce the transport of radon towards the surface of the Earth. And the aggregate housing measures were a proxy of housing quality, which may describe region susceptibility to having elevated rates of indoor radon due to more entry points. Okay. I feel like a celebrity or something. I've never used this type of microphone before. anyways, okay. So we have essentially a training data set and a prediction data set. So the 1,000, approximately 1,000 observations which had observed indoor radon concentrations also had an observed indoor radon vulnerability. And each of the BDAs in the province were associated with the same predictor variables. And so then the idea was to create a model based on the observed data set using a statistical classifier. Yeah, this is weird. Okay. Um, so essentially, we selected a machine learning algorithm called random forest that can it's a very high performing statistical classifier that can model high order interaction effects, nonlinear relationships, and can accommodate mixed variable types. And so I'll sort of describe the random forest classifier. And so essentially how it works is it builds a user specified amount of classification trees and averages the results over all of the trees. And so each individual classification tree in a random forest is built from a bootstrap sample of your training data. So it randomly selects 66% of your training data. And in our case, we used a balanced random forest. So we took a stratified random sample to ensure that each tree had low, moderate, and high represented because we had a very imbalanced data set. And so classification tree will recursively partition your bootstrap sample, so meaning splitting it into two nodes based on the value of a predictor variable. And so each of the resulting nodes will be associated with some proportion of each class. And the higher the class purity, so the more of one class in a node, the better the split, essentially. And so each tree will be defined by a series of decision rules based on these binary splits. So it could be one node is classified by greater than 2 degrees Celsius average winter temperature and a soil parent material of fluvial glacial. And 8 out of the 10 in the nodes are classified by high. And so if you put in an observation down this tree that has the same characteristics, it'll classify it as a high because 8 out of 10 in the training data were high. And so the random forest, so it essentially will create these classification trees, and it'll add an element of randomization to make sure that you're not overfitting the training data set by randomly selecting a subset of your predictor variables from which to select the best split. And it also has the advantage of being able to estimate, have an unbiased estimate of error internally. So for every classification tree that the algorithm builds, there'll be a proportion that was not used to build that specific tree. It's called out-of-bag data. And it essentially just runs it down the classification tree and will come up with an estimate of its, in our case, radon vulnerability. And every time that an observation is not used to build a training or to build a classification tree, every time it is out of bag, it will have an associated prediction. And over all trees, the class that was predicted to be the most times will be the predicted class. And so you can compare this to its observed class, and you can come up with an estimate of error. And so when we look at the classifier's performance, we measure the overall accuracy through a kappa score, which is a more robust measure of overall accuracy when you have an imbalanced data set. And it performed moderately well, 34% better than a random classifier, not like a pure random classifier, but a classifier with some sort of constraints based on your observed data set. You can talk to me about that after if that doesn't make sense. And essentially, the way the model was performing was if we look at what's called a confusion matrix, where we compare the actual to the predicted, the classes of moderate and high were predicted with a moderate amount of accuracy, and that a lot of moderates were being predicted as high and a lot of highs as moderates. And so precision measures how precise the performance was in terms of those that were classified as high, how many were actually high. And so it wasn't very precise, but overall not too bad. And so we looked at what were the most important variables towards describing indoor radon vulnerability in the province. And so the top four, so this is a metric called variable importance, and it essentially just records how important a variable is by comparing the original model's accuracy with a model where the values of one predictor variable was randomly shuffled. And of those variables, where there is a greater decrease in the accuracy, we infer that they have a greater explanatory power, and we can compare them and rank them in terms of their importance in this way. So the top four were average winter temperature, soil parent material, average winter precipitation, and distance to nearest major river. And so we looked at the top four in a little bit more detail through partial dependence plots. And so the way these plots are interpreted is they have class probability on the y-axis and the range of values of the predictor variable on the x-axis. And so for this plot here, for example, it's looking at the probability that a spatial unit was characterized as low, and that probability increased with warmer temperatures. And so from these partial dependence plots, the general things we could infer from it were that colder winters, wetter winters, closer distances to nearest major rivers, and colluvial and fluvial glacial soil parent material were the characteristics most associated with a high probability of being classified as moderate or high. And so the closest distance to nearest major river was kind of cool to see, because that sort of quantified that relationship that was theorized to exist. And so because each of these units are tied to a spatial location, you can take the predictions. So we predicted for those areas that were unmeasured using our model, and then we can map the results. And then we can overlay different census boundaries and figure out which areas that don't have predictions are predicted to be high risk, and which regions in general are higher risk based on this map. So you can see that a large portion of the aerial extent of the province doesn't have a prediction, and that is due to the fact that it had a value of a predictor variable that wasn't present in the training data, and therefore when you put it down the tree, it wouldn't recognize that specific level of that variable and couldn't come up with a prediction for it. And so we did just that, in that we overlaid it with population-centered boundaries and defined overall vulnerability by the proportion of spatial units that were predicted to be moderate or high. And so the really interesting result from this was also the fact that we could look at ones that had very little samples or no samples and were predicted to be high risk. And this is good information to know going forward for further sampling campaigns to try and find areas that could be at high risk that weren't previously known. And a lot of these areas are fairly small and low population, so this could be why they weren't sampled in the first place. And so overall, the model overestimated the prevalence of moderate and high vulnerability, but it was able to depict areas of lower and higher radon with much greater accuracy. So like I said, the moderate and highs were sort of fluid. They were getting mixed up with each other. So if you combine these classes into moderate or high and came up with a binary classification of vulnerability, the accuracy would improve to 81%, and the precision would be 51%, which is a lot better than the results that I previously showed. Oops. And so this brings me to my second paper, which has undergone a couple of name changes. So this really complicated name just basically means that we modeled different scenarios of risk based on using different concentration thresholds. So the last one was based on 200 becquerels per meter cubed and 600. We used a binary classification of radon vulnerability, so we combined the moderate or high, and then ran essentially 8 different models using concentration thresholds that varied from 50 to 600 becquerels per meter cubed, and then examined how this changed the spatial distribution of radon risk. And then we looked at how lung cancer mortality trends differed between areas predicted to be high risk and low risk through the crude ratio, and compared them for all the scenarios of risk. So we used an additional data set called, or available from the BC Ministry of Energy and Mines. It had the geocoded locations of uranium deposits that were of significant economic importance. So I guess a lot of it. And we added distance to nearest uranium mineralization as a variable as a more accurate proxy to what the uranium content of the underlying soil or bedrock might be. And we also estimated the population within each spatial unit through census data, and we had geocoded mortality data from BC Vital Statistics that's archived at the BC CDC, and we had lung cancer mortality and all natural mortality, and anonymous location of it, of where the decedent lived. So this was our class distribution for each of the different scenarios that we were going to model. So when we reduce the radon threshold, the class balance, or the classes, the ratio between low and highs essentially becomes more equal, which is intuitive. And so, so we essentially came up with 8 different models. And when we look at the classifier performance, essentially the overall accuracy increased by quite a bit with the more balance that was present within the training data set, which makes sense because random forest is generally designed to classify balanced data sets. Even though we use the balance variant to compensate for this, it clearly still shows up in the results. And essentially, the high class was predicted with more accuracy and precision the lower the concentration threshold was. But overall, each of the models performed with either good or adequate amount of accuracy, in my opinion, I guess. So when we map the results, obviously the prevalence of areas characterized as high risk increases with a lower threshold for delineating risk. However, that increase wasn't equal through space, so different regions were more affected by a decrease in the radon concentration threshold. So in this plot, essentially, we looked at the proportion of high BDAs occurring within a census division, and then plotted the trends by their economic region, which they aggregate up into. And the proportion of high BDAs increased by quite a bit in the Northeast, the Nunchako, the Caribou, as well as the Thompson Okanagan and the Kootenay. So essentially the northern and interior regions of the province were a lot more affected by a change in threshold than the west coast of the province, which you can observe if you look at the different maps. So it's decreasing this way. And then we also looked at, of those areas that are predicted to be high risk for each of the models, how many people are living within those areas. And essentially, the more northern regions of the province are a lot more sparsely populated. So even though their total area was predicted to be higher risk with lower concentrations, they don't have generally a lot of people. So you can see that in these trends, and that the areas in which most people are living in high risk spatial units is the interior, including census divisions in the Thompson Okanagan, the Kootenays, and Caribou. So the next thing we did was to visualize the lung cancer mortality trends as a way of assessing the different concentration thresholds, as well as in a sort of ancillary way, the validity of the first paper. So we would expect generally that areas that are characterized as high risk would have elevated trends in lung cancer mortality compared to areas that were low risk. And so that was the trend that we were expecting to see if the mapping was accurate. That is the trend that we did see overall. So you can see from this red line here. So I should explain that essentially what we did was for each mortality, we assigned it a rating of high or low for each scenario that we modeled. And then we just simply took, based on a spatial location. So like I mentioned, the lung cancer mortality data was geocoded, so it had a point data set, a map of all the mortalities occurring between 1998 and 2013. And then we just plotted the ratio between lung cancer mortality to all natural mortality occurring within areas of low or high vulnerability. And so we also assigned each of the mortalities a rating of smoking risk, I guess, smoking exposure. So smoking prevalence data are available at the local health area resolution. And we assigned each local health area a rating of high smoking or low smoking based on whether the smoking prevalence was above or below the median provincial smoking rate. And in this way, we attempted to mitigate some of the confounding that would occur from smoking rates. So in BC, it's known that a lot of the rural areas are higher smoking, and they also happen to have a lot of, or are more susceptible to radon. So this is sort of just a coincidence, but it would confound any results that would be based on spatial location. So the total trends were not unexpected. And when we stratify further by whether or not the decedent lived within a higher smoking area or a lower smoking area, we see that the trend completely disappears. It kind of becomes random. However, in areas of lower smoking prevalence, we can see that in areas within lower smoking LHAs that were predicted to be high risk had more consistently higher crude ratio. And that distance decreased with the decreasing threshold. But interestingly, even a threshold of 50 becquerels per meter cubed still showed elevated trends compared to the areas that were low risk. And so we then also stratified by sex. And so sex is thought to play a role in the susceptibility to lung cancer and could modify an individual's susceptibility. And the trends were quite different between males and females. They were decreasing through time for males and increasing through time for females, which would suggest that gender or sex, has a modifying effect. And so the use, I think this paper does show that how different guidelines provided by different organizations throughout the world can have farther reaching implications, not only for individual homes and whether or not people decide to remediate, but also for like radon mapping products that are available. So the first radon map I showed you of the local health area, if Health Canada's guidelines were 100 becquerels per meter cubed, areas characterized as high would be different. And the same goes for my paper, and the spatial distribution of high-risk areas changed by quite a bit with different concentration guidelines. So radon maps are used a lot in policy to sort of direct radon reduction resources or change building codes to make sure that certain areas that are higher risk are implemented with radon remediation measures when they're built. And yeah, so this paper kind of highlights the fact that these are very important things to consider. And that the use of a concentration threshold that is might be considered too high can mask areas at higher risk and deprive people of potentially life-saving, I guess, resources for testing their home and remediating. And that majority of the lung cancer mortality worldwide generally occurs at exposures lower than 200 becquerels per meter cubed, which is currently Health Canada's guideline. So there was a study in the United Kingdom that estimated that 96% of the mortality from radon, or in which radon was a factor, was due to exposures less than 200 becquerels per meter cubed. And that's essentially because of the sheer number of people who are exposed to lower concentrations. So the risk isn't as great, obviously, but there's just more people. And so radon concentrations are traditionally log normally distributed in most spatial aggregations and are characterized by mostly low risk concentrations, or low risk in parentheses, I guess. So yeah, I think essentially the overall value of this research was we contributed evidence towards the discussion of using a lower guideline than the one that is currently employed by Health Canada. World Health Organization recommends 100 becquerels per meter cubed, and I think that should be something that we would strive for from a policy perspective. And that's it. So thanks for coming, and yeah.
Thank you, Michael. We'll start to see if there are any questions in the room here first, and then we'll go online. Michael, would you be able to repeat the question? Oh, no. Yes, that's right.
I'll just speak. Okay. Thank you. I am curious then how you've been directing your findings and how people have been receiving it. Like, are you bringing it to the attention of the federal government, provincial government? Like, how are you going to get this actually used? Because it seems like a really valuable set of findings in terms of showing some of the uncertainties and the way that different cutoffs can change the interpretation. So how are you going to make sure that it's taken into account?
That is a good point. I'm going to essentially answer that by saying that is now Sarah's responsibility. I know Sarah presented some of these findings before when they're somewhat preliminary in Ottawa to some federal agency at some point. You'd have to ask her about the details, I'm not sure. But yeah, I think she's on it. So.
Anyone else? I have a question, actually. I'm still thinking about the map where you show population vulnerability by province, so low, medium, and high risk. And it seemed to me that for British Columbia anyways, there's a much huger swath of medium risk areas. So if we talk about lowering the guideline to 100 becquerels, that would obviously change the distribution of medium and high risk. But have you ever thought of or come across any work in mapping out population concentrations around the medium and high risk areas? Because as you said at one point that some of the northern areas is not populated, so it really doesn't matter. But in terms of intervention efforts, it would, and priority setting, beyond the education and awareness raising, we want the public to move toward intervention. So when we want those areas with the most people affected to get on board, to get their corrective actions in place, be it the sort of the lining in the basement and venting out, those sorts of things.
Yeah, totally. And I think that is definitely the way that resources should be prioritized, I think. If there's a limited amount, you want to be able to affect the most change in the most people you can. And so I know some heavily affected regions, such as Prince George or Castlegar, have quite a bit of radon awareness going on just at a local level. But I also think there needs to be more change from a policy perspective in order to motivate people to actually test their homes and change them. Because currently the burden of cost for any of the remediation measures are completely on the homeowner. So there needs to be some sort of legislation in place to alleviate that burden, because it becomes a kind of an environmental justice question then too, because people who don't have enough money can't afford to pay $3,000 for these systems. So yeah.
So you may not have the question. So the tension is that by lowering that action point might make it even more difficult for more people to act.
Yeah, and I think, well,
of course, from a health perspective, we need to look at the science.
Yeah, and so I think while this is true, more people would need to remediate their homes than at a higher concentration threshold. I think it's pertinent from a population health perspective that people know that there's still a level of risk associated with concentrations like around 100. And I was going to say something else, but I forgot. Yeah, I can't remember. Sorry, I lost my train of thought.
No problem. Come back to it. I'll ask one more time if there's anyone. Okay, Jesse?
In your opinion, do you think people generally know, like the general public, know what radon is and the risk it poses? Like just sort of anecdotally, I think most people who I've talked to who aren't in public health don't know what radon is. They don't know it can accumulate in their home, and they don't know it like poses a risk to them.
Yeah, no, it's very true. And there is the latest census data, I think, showed that 42% of homes had never heard of radon nationally, and that 12.5% of homes nationally actually knew that it was a health risk. But so, yeah, it's definitely a awareness issue that needs to be raised, and so that there could be more pressure to implement more, I guess, progressive policies.
So even if we do change the guideline, for example, if half the people don't even know about it, then it's almost like a mute thing to do. So do you think there would need to be increased like awareness and increased campaigns to raise awareness for it?
Yes, so I think lowering the concentration threshold in itself is not nearly a satisfactory enough, I guess, provision, and that it sort of needs to be a more comprehensive approach that includes increasing awareness through more commercials featuring Mike Holmes, hopefully, and also more better policies for future. That's what I was going to talk about. Was future construction changing building codes to enforce a certain level of concentration after it's built. So making sure that all homes built, especially in high-risk areas, are already fitted with radon reduction measures, and then have the concentration within the home legally enforced to be below a certain level.
Can I just add a point to Jesse's too? That maybe because British Columbia only has small pockets of high radon area, that if you go out into the streets and survey people, they may not be as aware of radon as a public health problem. And Alberta's the same. They have pockets. But you go to high radon provinces like Saskatchewan and Manitoba, I bet you the general knowledge of radon and negative health impacts might be higher. So that's one thing. BC Lung Association is doing a lot here locally in the province to raise awareness. So and Sarah is very much involved with going around Prince George, Clearwater, Castlegar, to also involve the building trades. So they are the less educated in terms of the health effects. So they need to be brought on board. So do engineers, right? So it's a cross-disciplinary awareness, not just the public. And the other point that I want to raise is that, it might require change policy in certain public health settings, for example, childcare settings, daycare, where the vulnerable population is involved, like children and the elderly, particularly children, because with lung cancer development, the latency period is so long, and young children being most affected, they spend many hours in a daycare setting. If they happen to be in a daycare in a basement of a high radon ground area, you could imagine the outcome. So if the public start advocating at that level, then that could influence, go upward toward policy changes. Because it's a complex situation to effect a policy change, especially involving such a massive scale, changing building codes. There are some headways being made in that regard, but it's the existing buildings, residences, that we're concerned about. And I'm not even going to talking about workplaces where people spend 8 to 10 hours or more a day in. Okay?
True.
All right. I'm just going to check to see if, there is an audience member online who has a comment from Jenny. For anyone interested, there are many stakeholders, including the Canadian Cancer Society and Radon. To date, the Canadian Cancer Society have worked on building capacity in the building industry. So if anyone would like to know more about how to get involved, Jenny Byford would be very happy to have a discussion, and she had provided me with her email address, and I can happily share it with you. Okay. If there are no more questions from our in-room audience here or our online audience, there is one. Okay. Okay.
Just wondering if there are any other countries, I guess, that are leading the way in radon prevention. Are there any examples that Canada could go by? If the WHO has a limit of 100, are there countries that are following that?
That's a good point. And I can't actually think of any countries that have 100 becquerels per meter cubed at the top of my head. I know in the USA it's 150. Yeah, I'm not sure about other countries. That's a really good question.
Okay, so thank you for being an engaged audience, both here in person and online, and most thankful for Michael sharing your work and your insights with us about this very complex topic and interesting topic. And thanks so much for your passion in mapping, because without it, we wouldn't be seeing these colorful instruments. So thank you once again. Let's join me in thanking Michael.